Hey there, I'm Dr. Josh Jagoda, chiropractor and soft tissue specialist, and today what I wanted to do was talk to you a bit about scar tissue, how it forms potentially, how it can impact you, and yeah, this episode might go on a little bit longer, but I think you'll find it very informative because we'll talk about everything from A to Z when it comes to scar tissue and what the purpose of treatment of that scar tissue can do. So first things first, what is scar tissue, and how does it affect you really? And after an injury, what can happen is maybe the first week you don't develop scar tissue, but as the body starts to piece together different types of soft tissue, what can happen is that the layers of the soft tissue may not line up like this. They may heal in what we call a haphazard or cross lineages, and it may kind of heal like a checkered pattern like this. And what can happen is that the whole thing about scar tissue is what happens is that it doesn't allow muscles to glide and slide very well. So if you think about a muscle here and a muscle here, like here's a bicep, and then underneath the biceps the brachialis, and if the bicep is stuck like this and it's not sliding as we extend that elbow, what can happen is we can get pain into the bicep, we can get pain into the elbow, we can cause some other problems that maybe run up to the shoulder or down into our arm, because what can happen is that this glide and slide can cause not only friction, which can cause pain, but again it can cause more dysfunction, more adhesions. And in addition to scar tissue is actually very avascular, meaning it doesn't have a lot of blood supply. So if you're normally supposed to have a lot of blood supply, let's just say in this muscle right here, what may happen is that if you have scar tissue that occurs right in there, it may take away some of that blood flow and that healing ability for that to happen within that area. So now you have an injury that now started to scar over, and now that you have this scarring, you have a little bit of less blood flow, which makes it even harder for you to heal. So a lot of people ask me, is scar tissue bad for you? Is it good for you? And based off of what I just said, you might be thinking it's bad for you, but there are actual times where scar tissue might be good, because again, it could serve as the framework or scaffolding for better quality tissues to come in. So when we have it through a muscle or through a very vascular area, that's where it can become problematic. When it starts to stick to different structures like nerves or arteries or veins, that's where we could see impingements. We could see what we call peripheral nerve entrapments, which really means that we have scar tissue that is bound up around a muscle and it shoots down into our arm or into our leg. Something might be seen like in a chest area where we get arm numbness and tingling, and it could be as a result of some scar tissue that goes on into here. It could happen into the neck, but overall this can be fairly painful. But there are some times where scar tissue can be good. Again, it could be serving as that scaffolding, as I mentioned before. But really, we have functional scar tissue and non-functional. The non-functional is what I mentioned just before about, hey, it can be problematic, but functional means that maybe in a ligament, for example, where ligaments are a lot harder to heal, they're a lot deeper structures and they're a lot less vascular. And so what we may need to do to help stabilize that body or that area is have our natural ability to have scar tissue come in. That's really functional, right? Because what is happening is that after that injury occurs, we're literally having our body self-heal. Maybe it's not perfect yet because it takes some time through soft tissue releasing and scar tissue releasing, which we'll talk about. But really what we're doing is we're taking these dysfunctional patterns that are broken, maybe injured, maybe partially even torn, and we're gluing them back together naturally through our body's ability to heal. So that's where functional scar tissue comes in, and that's really good. It just matters that if it stays functional, if it becomes non-functional, that's where pain can come in, as I mentioned before. So what does the research say about scar tissue? Well, we know that scar tissue does exist. As I mentioned, there's functional and there's non-functional, but really the most important thing to know right now in 2020 is that it's not as much how much scar tissue is there, it's how do the muscles slide and glide past each other. This is something that we talk about a lot in the office. This is something I talk about before I do any procedures or therapy with my patients, because it's really important to understand that when you get muscles to glide and slide smoothly evenly past each other, then you create a mechanism where everything is just nice and smooth. Essentially, it's free flowing, right? And that means that if there's less friction, there's less irritation, there's going to be less pain, there's going to be better synovial fluid or the joint lubrication that's going to happen, and the body and the motion's just going to function a lot better. So it's really important that patients focus on soft tissue release as well as mobility training when it comes to scar tissue releasing. Some of the techniques that we use in our office to help reduce scar tissue adhesion, to help promote mobility, and to help glide and slide those muscles and those nerves, those arteries, those veins easily through the body, and just take a whole bunch of pain relief off of patients, whether it's neck pain, shoulder pain, back pain, hip pain, pelvic pain, is a few different modalities, namely, and you're probably familiar with some of them, they're called myofascial release. Of those myofascial release, there's two that I primarily focus on, and that is active release technique or active release therapy, as well as Graston technique, and a lot of people also refer that as scraping. So the reason I believe that these are very, very important types of modalities or treatments is because active release gets to the ability to pin down the muscle while we lengthen it. And that is really important because it helps promote the mobility. Whereas Graston technique is those stainless steel tools where you're starting to scraping and you're promoting a lot of friction, I should say, and soft tissue movement. And what you do is you get to mobilize the tissue very, very well. In addition, we do prescribe a lot of exercises that help increase the mobility. And it's very, very important, and I think this is a very neglected point that I'm going to make, is that a lot of people neglect the rehab as well as the mobility training. The reason that is so important is because, one, you're going to strengthen the tissues in a better state. Two, you're going to help that haphazard pattern or that scarring pattern that may heal like this. And with time, as you exercise, you're going to be doing a little tearing of those tissues. As you tear those tissues, they start to reheal. And you tear them again, and they reheal, and you tear them and reheal, and eventually they go from this position to start healing in this position. And what that does is that it allows those sliding and gliding mechanisms, as I said before, to become that much more effective. So it's really, really important to note that yes, you do need the scar tissue release. Yes, you do need the myofascial release. Yes, this stuff is extraordinarily effective, and it has helped me help a lot of patients, whether it's neck pain, like I said, or prevent surgeries and things like that. But it's really important that patients do their rehab because it helps strengthen those structures, and it helps those blood flow, and it helps people heal faster, so that maybe in the future what they can do is they can get maybe 2 or 3 therapy sessions a week instead of 1 because they're not doing their exercises. And as a result of having more therapy sessions, they heal faster, and as a result of healing faster, you get a chance to go back and do the things that you love to do a lot quicker and with less pain. So to finish off and let you know, soft tissue releasing, scar tissue releasing is absolutely a very, very effective treatment to help the mobility, to help pain, and to help people just start feeling their best, as well as getting them back to the activities they love. I've seen so many patients over those years, over 10 years of being in practice, and I've been doing scar tissue releasing and soft tissue therapy for about 12 now, and it's really been a fascinating thing to see people really turn their life around, because with just a little bit of treatment, and it doesn't need to be a lot, just with like maybe weekly treatment or every other week, I have seen people avoid surgery. I have seen people get out of pain. I have seen people get back to the things they love very quickly. And it really just does help the whole healing process, and it does really cut down the time. So if you are somebody who is really looking to get some therapy, to release some tension, to get out of pain, and maybe you're having some difficulty, maybe some soft tissue therapy, some myofascial release, some scar tissue reduction is maybe a good fit for you. So if you have any questions, please feel free to reach out to us. I'd be happy to answer any, and I'll see you guys soon.